Hello again. Now, the South African Veterinary Association says it's regrettable that government has not sought advice from them on how to manage COVID-19. It says veterinary specialists have vital skills and could be usefully deployed in the fight against the coronavirus. Well, let's find out more now from the association's president, Dr. Leon De Bruyn. He's talking to us from Pretoria. Dr. De Bruyn, a very good morning. Thanks so much for your time. Tell us how veterinarians could be used in the fight against COVID-19 right now.
Good morning, Uveka. Thank you very much. Good morning, Kumora, Dumela, Salbona, to everyone. I'm actually in Port Alfred, Uveka. Our head office is in Pretoria, but I'm in Port Alfred, and please excuse if I'm not in usual clothes, but we've just had to haul a calf out of a heifer and jump in the shower and clean up.
Okay.
Just to clarify, the article in the Maverick was from Dr. Morane in his capacity. We're supportive of him in terms that we have a lot to offer. Vets often have to deal with pandemics, particularly viral pandemics like foot and mouth disease in the past, the rinderpest and avian influenza, swine fever. So we have a lot to offer. We're not criticizing the government. The government's done an amazing job, and we liaise with the government veterinary department quite a bit. And as the Chief Veterinary Officer of the nation, Dr. Mike Mudasani, says the government has used them in terms of equipment, ventilators, vehicles, and consulting. But we just feel we have the epidemiological skills. We have virologists that can support the government in particularly surveillance and modeling to help control the spread of the virus.
Can you be more specific about that then, in terms of your knowledge and your skills? Specifically, where would you be able to be used? Like you say, not in the treatment, of course, because, I mean, it's a very different thing, but would you be involved in maybe vaccine development? Would you be involved maybe in sort of trying to figure out, just how this, how this virus is being passed on, how it's working, how it's changing?
Yes. Well, what we're good at in South Africa is controlling epidemics, particularly in our animal viruses. Now, remember, a virus doesn't distinguish between a human host and an animal host. So the spread of the virus works in fairly similar patterns. And we are quite good at controlling these outbreaks. And the private veterinarians work in hand with the government veterinarians through the National Animal Health Forum. And we can help model with our epidemiological models, work out how the virus is spread, how to contain it. They have helped, the World Health Organization has worked with the OIE, the animal version of the OIE, to look at how the virus works, because this is a virus that came from animals, and most viruses, approximately 70%, are zoonoses, which means they come from animals and spread to humans. So yes, the actual treatment leaves to the medical professionals and how it works in hospitals, but we do have a lot in terms of biosecurity. If we see how we operate our farming operations, that we can help in terms of the correct way to help prevent the spread of the virus. And we can also, the vaccine development will generally work with the pharmaceutical companies, but veterinarians are used to dealing with vaccines, with the cold chain, sterile injections, aseptic technique, and if necessary, we don't want the viewers to become scared, but the vets are equipped to be able to inject them. And we have to be able to inject pain-free, because you remember, if we hurt our patients, they might bite us, kick us, or scratch us. So we can help in that regard.
Well, I think the same might apply to some humans as well, Doc, in terms of biting and scratching as well. So you do say that we know that this virus has emanated from an animal. I suppose the jury's out there. You'll always have the conspiracy theorists about this as to where it's actually come. Are you convinced, coming from this sector, that this has come from an animal? And would you be able to help sort of pinpoint the actual origin?
No. Well, our epidemiologists and the international ones have worked on that. Yes, there are the conspiracy theories about China, but we've seen this pattern in the past, Uveka, where if you look at the SARS outbreak before, that what is happening in those wet markets is they're putting animals in close proximity with each other that are not meant to naturally be with each other, and that provides, under that stressful market condition in close, intensive conditions, for that virus to jump between species, and that it then mutates. And that is the problem now, is once it begins to mutate, that DNA loosens, and as we've seen now, we're dealing with the second strain that is different and is more virulent. But yes, internationally, that
Oh, we seem to have lost that line there to Dr. Leon De Bruyn. I was going to ask him to weigh in on the ivermectin debate as well, seeing as it has been used in animals. Let's see if we can reconnect with him quickly. Dr. De Bruyn, if we do have you back, I really, really would like you to try and answer this one and put you on the spot a little bit. Can you weigh in on the great ivermectin debate at the moment, seeing as it is something that is used to treat parasites or get rid of parasites in animals? Can you weigh in on its use to treat COVID-19 in humans?
Yes. So, as president of the South African Veterinary Association, at this stage we've got to say, look, ivermectin is a product that's registered for animal use only in our country, but it's a dynamic situation. We have to advise our members and the public that it's for animal use. However, the research is growing daily that ivermectin is effective in the treatment of coronavirus COVID-19, and it has actually been registered with the FDA and the World Health Organization to treat humans for parasitic conditions, scabies, mange, for instance, and internal parasites, Filaria worms, for decades. So we know it's relatively safe in humans. So it's just a question of assembling enough data, and there's a lot of it, and there's peer-reviewed studies that daily are coming on. And we actually, over the weekend and yesterday, we were collaborating with the Chief Veterinary Officer to advise the Minister of Agriculture and then meet with the Department of Health to say this is the evidence we have. And, we're in a disaster emergency situation, Uveka, and the normal, if you see the vaccine development has been fast-tracked, and we maybe need to be a little bit more flexible at regulator level of once we have the evidence of fast-tracking, because above all, we must save lives. We need to look at our country and how we can help the people. So in terms of the treatment, the ivermectin, it appears to be effective. Once the regulator is happy that we have enough evidence, hopefully then we can use it. And we're in a position, we've been using this product for decades. We know the dosages, we know how it works. And then again, with the vaccine. If I must say, Uveka, we were in the essential workers and essential services list at level 5 lockdown. And strangely now, the vaccination rollout, veterinarians are not on the essential services list for phase 2, which is a bit concerning. And we've contacted the Ministry of Agriculture and Health, and we've received feedback. And we're working on that as well, because it's important in terms of veterinarians. We have to have some sort of contact with the public and our clients to ensure food security and the health and welfare of the animals, which are essential services. So it's important that we and the public are protected in the vaccination strategy as well.
Okay, Dr. Leon De Bruyn, thank you very much for that and for your time this morning.